Hello everyone, my name is Emily Kosick and I'm the Knowledge Manager for the Canadian Institute for Public Safety Research and Treatment. Welcome to today's session, Moral Injury and Public Safety Occupations. We're happy to be able to partner with the Center of Excellence on PTSD to bring you this session today. Before we get started, I just want to go through a few housekeeping items. All attendees are in listen-only mode, then that's to limit feedback and noise on the session. Today's session is being recorded, so you will be sent a copy tomorrow. If you miss anything, you can certainly watch it again. The GoToWebinar launch window can be blocked by some organizations, so if you're having trouble hearing or seeing, you may need to join us by phone. We will be looking for audience questions at the end of the session, so please send us your questions throughout the session in the questions box, and I will present them to the speaker when we are having our question period. So I have also placed a French version of the presentation as a PDF in the handouts for those of you that may prefer to have the information provided in French. So let me go ahead then and introduce today's panelist, or rather speaker, I should say. And this is Fardous Houazani, and he is the Deputy CEO and Vice President of Research and Public Policy at the Center of Excellence on Post-Traumatic Stress Disorder. I want to thank you so much for being here today. And I see that your presentation's up, so I'm going to go ahead and step back and I'm going to turn it over to you.
Wonderful. Thank you, Emily, and thank you to the Canadian Institute for Public Safety Research and Treatment for the invitation to speak to you all today and on this important topic. And thank you all for joining the discussion. As Emily mentioned, my name is Fardous Houazani, and I'm the Deputy CEO and Vice President of Research and Policy at the Center of Excellence on Post-Traumatic Stress Disorder. I'd like to begin by acknowledging that the Center of Excellence for PTSD is located in Ottawa on the traditional and unceded territory of the Algonquin Anishinaabe people. This event was also scheduled to have a speaker whose presentation would focus on their lived experience of moral injury. Unfortunately, that person was no longer available to speak at this event, but I did want to take a moment to acknowledge the efforts made by the organizers to include the perspective of someone with lived experience. The perspectives of people with lived experience and lived expertise of mental health problems and illnesses, and here moral injury, promote awareness and understanding, provide insight into mental health problems, and reduce stigma and enhance capacity and empathy and compassion towards people with lived experience. So I did want to acknowledge that before we got into the presentation. So before we get into the specifics of the presentation, I did want to highlight the 4 learning objectives of this presentation. So number 1 is hopefully by the end, you'll understand what moral injury is and how it differs from other responses to stress and trauma. To learn about examples of potentially morally injurious events reported in research on moral injury in public safety settings. To learn about the mental health outcomes associated with moral injury and how to recognize them in yourself and others. And finally, to learn about practical approaches to address the potential mental health impacts of potentially morally injurious events and to prevent moral injury, whether you're on the front line or a manager. So what is moral injury? And to be honest, we're still trying to define moral injury. A review paper from 2017 extracted definitions of moral injury from the literature and found there were at least 17 different definitions, all with slight variations. The concept of moral injury was developed and named by clinical psychiatrist Dr. Jonathan Shea. And the concept emerged because it captured the experiences of those military members and veterans whose mental health and related concerns were similar to PTSD, but did not meet the criteria for PTSD. The moral injury has mostly been studied in the military and veteran context, but as I will discuss, there's a growing study in other contexts, including public safety. And although there's not yet a consensus or agreed upon definition for moral injury, there is agreement that moral injury and PTSD are distinct phenomena. However, moral injury and PTSD can co-occur. On the next 2 slides are just a few of the definitions of moral injury that are most often cited. Together, these definitions contain core elements of what moral injury is, what it might feel like for a person. As mentioned, Shea, who worked with Vietnam veterans in the United States, is credited with coining the term moral injury. He published some of the first works on the topic, which drew on his clinical experience and was instrumental in the development of programs to build moral resilience in U.S. military veterans. Shea describes moral injury as a betrayal of what is right by someone who holds legitimate authority in a high-stakes situation. The key components of this definition are authority, someone with the power to affect the outcome of a situation, a high-stakes situation where the degree of risk is high and whereas one, decisions or actions have the capacity to cause harm, and betrayal, the violation of trust, confidence, or a moral standard, whether that trust is established or presumed. Brett Blitz and colleagues at Boston University added to this definition. Their expanded definition acknowledges the types of consequences that such actions may bring about. It also emphasizes that moral injury can arise not only from feeling betrayed by others' actions, but from one's own actions, especially when they violate deeply held beliefs about what is right. This is the most cited definition, and the key components of this definition are the psychological, biological, spiritual, behavioral, and social impacts, the area of a person's experience that are disrupted by these acts. These impacts can arise when someone fails to prevent, bears witness to, or learns about acts that transgresses deeply held moral beliefs and expectations. Another definition is the one developed by Gabrielle Letney and Rita Nakashami-Brock. In this definition, the spiritual lens is emphasized and moral injury is seen as a wound in the soul. And the key components of this definition are that it adds witnessing traumatic loss, like a close friend being slain, and preserves LIT's team's emphasis on the ways moral injury can occur through active or passive behavior or inaction. Today, Dr. Brock is the director of the Shea Moral Injury Center, which runs workshops on moral injury and programs to build resilience in those who have experienced moral injury. And the last definition I want to highlight is one from Jeremy Jenkerson. This definition takes a syndrome perspective. And the key components of this definition are that unresolved moral distress can lead to the syndrome we call moral injury, with symptoms that emerge in different domains of life. There are some symptoms associated with these definitions of moral injury, and I'll address these later. But in summation, the construct of moral injury describes the psychological, spiritual consequences of events that seriously violate your core moral beliefs and expectations. At present, research and clinical work is ongoing to understand exactly what these consequences are and what is common among people who have experienced events that may lead to moral injury. These events are called potentially morally injurious events, and I'll define them later on in the presentation. Also, research is underway to determine how to assess people for moral injury, to identify whether treatments currently used in PTSD might be suitable for moral injury, and determine the effectiveness of new treatments that have been developed specifically for moral injury. Potentially morally injurious events can be understood to exist on the more severe end of a continuum of moral stressors and related outcomes. This continuum outlines that moral challenges and stressors are more frequent than morally injurious events, and that moral frustration and moral distress are more common outcomes for individuals. In the same way that not all individuals who experience a traumatic event will experience PTSD, not all moral violations, potentially morally injurious events, will lead to the development of a moral injury. In the milder degree, you may experience morally challenging events which tend to occur more frequently, and these may lead to feelings of moral frustration. In the moderate degree, people can experience moral stressors or events that cause greater degree of moral distress. These are more acute than moral challenges and are likely to lead you to feel more salient moral emotions like guilt, anger, and shame, or moral pain. And in many cases, moral pain can be a normal response to these events and can be productive in affirming one's moral beliefs and in preserving relationships or communities. And morally injurious events are in the extreme degree, and they're located on the right side of the continuum. Morally injurious events are severe, lower frequency events that have a distinct impact on mental well-being and cause more severe psychosocial harms that can impact someone's daily activities, relationships, and functioning. If you experience moral injury rather than moral frustration or moral distress, you are more likely to see yourself as marked by the experience and to define yourself and or others in relation to the event or events. As mentioned earlier, not all morally challenging situations or events lead to moral distress or injury. Some experiences, although painful, may in fact lead to moral growth because they prompt self-reflection or new insights or strengthen character. Recently, researchers and clinicians have started to explore how moral injury occurs outside the military and veteran context. A key area of focus has been healthcare and public safety. This has prompted some new debate about the difference between moral injury and the earlier concept of moral distress, which was developed in 1984 to describe the impact of situations in which healthcare professionals, specifically nurses, know the right thing to do but can't. It is important then to emphasize some of the similarities and differences between moral distress and moral injury. Similarities include the fact and the element that moral integrity is present in both phenomena. Both reflect the personal relation to moral values and beliefs. And there are also some shared psychological consequences, like guilt, self-blame, blaming others, anguish, and a sense of powerlessness. The difference include the fact that the circumstances are different. Moral injury emerges from events where the immortality of the action is a key factor. The morality of the action is a key factor. And those events are followed by internal moral conflict. Moral injury focuses on external factors, like high-stakes situations beyond one's control in a broken system, and on internal factors where one is perpetrating, failing to prevent, or bearing witness to moral transgressions. And moral distress emerges from a sense of moral conflict in morally distressing situations, which are caused by external constraints like policy, structure, bureaucracy, or internal characteristics like moral sensitivity, threatened values, inability to demonstrate moral actions, or powerlessness. As noted earlier, severity and consequences for the individual also differs. Moral injury leads to a deep emotional wound, and moral distress leads to psychological disequilibrium, so imbalance, and negative feelings, so blaming others or oneself. It could lead to depression, anxiety, feeling embarrassment, or anguish. It can also have a negative impact on client and patient care. So you have a loss of ability to provide care, loss of integrity, loss of betrayal of values, and overall impediment of ethical practice. It can lead to burnout or reduced job satisfaction or low morale. And personnel may desire to leave the profession, which is something we're seeing right now in the healthcare community. Some researchers find that the main difference between moral distress and moral injury is that moral distress reflects a situational problem, while moral injury reflects on experience that produces long-lasting change in the person who loses hope, trust, and integrity. To date, research on moral injury has focused on examining the outcomes and impacts associated with moral injury, defining what types of events can be categorized as potentially morally injurious events, differentiating between events and outcomes and their respective associations with PTSD and moral injury. However, it's important to address the moral component of moral injury. And these are the 6 foundations of Jonathan Haidt's moral foundation theory. Number 1 is care, so protect and cherishing others versus harm. Number 2 is fairness, provide justice in line with shared rules versus cheating. Number 3 is loyalty, having standing within your group, family, country, colleagues versus betrayal. Number 4 is authority, respect, following tradition, submission to legitimate authority, and this is versus subversion. And number 5 is sanctity, so purity, avoidance of improper things or actions, and this is versus degradation. And number 6 is liberty, and the opposite of this is oppression. So while this is just one and certainly not the only theory of morality, it gives us insight into some of the dimensions that are compromised or violated in moral injury. Morality differs from culture to culture, and it can vary within communities or social groups. So what is a potentially morally injurious event? Until this point, we've indicated that exposure to potentially morally injurious events can be what lead to moral injury, but haven't defined what these are. Potentially morally injurious events, or PMIEs, can be events where you are directly or indirectly involved in or witnessing acts that violate your moral beliefs. It could be perpetrating harm or failing to prevent harm. And these events can be expected or unexpected, and it may be that you perceive harm at time event or when reflecting on the event. Some examples of PMIEs include witnessing atrocities or severe harm, making a decision that results in harm to others, including inaction or failing, being unable to prevent harm, deliberately or accidentally killing or wounding someone, harming yourself or others as a result of having to do things you aren't prepared, equipped, or resourced to do. While those examples, given the focus of moral injury in military, comes from the military context, many may be applicable to public safety personnel. Where these potentially morally injurious events lead to lasting psychological, social, and spiritual harm with adverse impacts on mental health, relationships, and quality of life, you have sustained a moral injury. This diagram outlines how potentially morally injurious events can develop into moral injury. When it comes to potentially morally injurious events, as we've noted, not everyone who experiences such an event will develop moral injury, just as not all those who experience a traumatic event will go on to develop PTSD. Let's take the example of PTSD. So most people who experience a traumatic event, such as a car accident, will struggle with the impact of the event. For example, they will re-experience the incident, they'll show symptoms of heightened arousal for some time after the event. But for most, these feelings will resolve with time as they reintegrate the trauma into their past. But when these feelings and problems persist for more than 1 month, the person may likely fit the criteria for a diagnosis of PTSD because they haven't recovered naturally from the experience as most people do. At this point, the person may benefit from mental health support, including assessment for PTSD or other mental health concerns. The same is true of moral injury. In moral injury, you're unable to reconcile your moral pain, and this leads to the intensification of uneasy moral emotions and judgments, which then lead to psychological and spiritual suffering. As noted, it is only recently that researchers and clinicians have started to explore the presence of moral injury outside of the military and veteran context. Researchers and clinicians increasingly recognize that public safety personnel are at risk for moral injury because they encounter challenging events that may also be traumatic and have lasting psychological impact. Research has suggested that police officers, firefighters, paramedics, healthcare workers, and journalists, because of the high risk, high stakes nature of their work, are all at risk for moral injury. With journalists, risk for moral injury is specific to those journalists who report from conflict zones, on terrorism, or during disasters or famine. The past years have seen growing academic interest in moral injury in public safety occupations, but the research is still mostly theoretical. More data needs to be collected to confirm these observations and to examine the prevalence and mental health impacts of moral injury in public safety personnel. And there are quite a few research projects currently underway that will help support this work. However, there is considerable awareness and research into the prevalence and impact of psychologically traumatizing experiences on public safety personnel, including the prevalence of PTSD, stress, and burnout in these occupations. There's increasing agreement among researchers that public safety personnel are likely also at risk for moral injury, given their frequent exposure to potentially traumatic and/or high-stakes, high-stress situations. In addition to the examples of potentially morally injurious events that I mentioned before, these examples are some of the moral challenges or stressors that researchers suggest may be specific to public safety personnel. Duties that contribute to serious injury or death, errors that cause injury or death, failure, which is actual or perceived to protect the public or to do enough, doubt in your tactical decision-making, enforcing a law that conflicts with your values, for example, arresting protesters whose cause you support, continual exposure to social problems, aiding perpetrators or people you find reprehensible, decline in willingness to help people who are suffering, incidents involving harm to children and youth, inability to complete your mission or the job as intended, and corruption in the organization. Now I'll highlight some of the impacts of moral injury on well-being. This slide shows the core domains of moral injury as identified by Dr. Bill Nash. Dr. Nash was a Navy psychiatrist for 30 years and was the director of psychological health for the U.S. Marine Corps. Now his work focuses on developing models of moral injury, as well as tools for the prevention, assessment, and treatment of moral injury and stress-related problems in veterans. In Dr. Nash's experience, the 6 core domains of human experience that are impacted by moral injury are: number 1, emotional experience, so feelings of guilt, shame, self-loathing, depression, numbness, loss of compassion, or desire for revenge. Number 2 is continuity over time, the sense of becoming someone else, your loss of identity. Number 3 is impaired self-regulation, like restlessness, rage or panic attacks, or self-harming behavior. Number 4 is spiritual connection, so loss of faith or leaving a religious community. Number 5 is the concept of self and world, so self-criticism, self-doubt, hopelessness, fatalism, and meaninglessness. And number 6 is relationships, where it leads to alienation, isolation, or severed ties. As I mentioned, moral injury overlaps with PTSD in a number of ways. Both involve an extremely stressful event that produces psychological distress. Both involve re-experiencing nightmares, intrusive memory, thoughts, and images. Both involve negative thoughts about yourself, others, and world. And both involve negative emotions and feeling detached from others. When potentially morally injurious events include a traumatic event, someone can certainly meet the criteria for PTSD. However, the debate is still ongoing as to whether moral injury is effectively captured by PTSD. In any case, there are some important differences you should be aware of. First is the etiology, so the origin or cause. So events that lead to PTSD involve threat to safety or physical integrity and threat of death. This may not be the case for moral injury. Second is to look at emotional reactions. Guilt and shame are common in PTSD, but fear-based conceptualization of trauma like horror and helplessness and recovery dominate for PTSD. But guilt and shame are more central to the understanding of moral injury. We also have to look at the attributions. In PTSD, there's an understanding that the negative beliefs resulting from trauma is erroneous or exaggerated, but this may not be the case for moral injury. So an individual may have really committed abuse, which are wrong, and the person should be held accountable. We also have to look at the physiological stress. So symptoms of exaggerated arousal, which is commonly seen in individuals struggling with PTSD, may not be associated with moral injury. And you have to look at the functions of symptoms. We know avoidance is a core symptom of PTSD, and we may see it in moral injury as well, but instead of avoiding reminders to experience, they may avoid social judgment for fear of being found out as a morally bad person. It's also important to highlight that PTSD is not the only syndrome that is related to moral injury. We can understand moral injury in relation to depression, complex PTSD, or even complicated grief. Moral injury features overlap significantly with all of these. In depression, guilt and shame are core features, as is a lack of interest or purpose in life, something we see in moral injury. In complex PTSD, emotion dysregulation and disorganization and self-concept are also present, another thing that we see in moral injury. And in complicated grief, inability to resolve event, grief of traumatic loss, loss of identity, spirituality are all present. This is also something present in moral injury. So as you can see, there is significant overlap between elements of moral injury and those of other diagnoses. Lots of work left to be done to actually distinguish between these. Recent studies have concluded that understanding what moral injury is and the possible and multiple impacts that can arise following exposure to potentially morally injurious events or potentially psychological traumatizing events is just the first step researchers need to look into. And what researchers recommend is that public safety organizations have a responsibility to ensure that public safety personnel are aware of the signs and symptoms that may accompany moral injury or a post-traumatic reaction, and how to recognize them in themselves and others, not just in the face of aftermath of these, but also before they occur. This highlights the importance of a proactive versus a reactive approach. So before we talk about how to recognize moral injury in yourself or a colleague, it's important to contextualize some of these points. Remember that as discussed, moral injury is not yet fully defined, and its features are those that are common to other problems of distress, like anger, guilt, shame, and features of distress in many areas. So we risk pathologizing individuals if we immediately conclude that the expressions of symptoms are a moral injury. It's important to note that given the experiences of potentially morally injurious events, moral distress is understandable. We don't want to assume that because someone has experienced a potentially morally injurious event, they have a moral injury. And this extends to traumatic events and PTSD. Individuals with moral injury are likely to hide their experiences. It takes time, patience, tact, empathy. Being too direct creates risk of prompting more distress. The best thing we can do to recognize moral injury is to be aware of it. It is really important to be attentive to behavioral signs and changes, like isolation or withdrawal, like lack of purposeful behavior, and looking for anger or aggression. It's likely easier to recognize features of moral injury that are behavioral, like isolation, lack of purposeful behavior, rather than emotional, like guilt, shame, because these emotions are prompt from withdrawal and secrecy, and fear of being found out is something that is seen a lot in folks struggling with moral injury. If you think a colleague has experienced a potentially morally injurious event or moral injury, it's important to create a safe space to discuss potentially morally injurious events or moral injury. It's important to acknowledge that moral stresses or difficulties are inherent in the work, and make sure you're really listening, and listening with patience and compassion. And lastly, it's important to encourage them to take care of themselves, engage in activities that support meaning making, like personal hobbies, like leadership opportunities, like volunteering. It's important to foster social connection and approach them without judgment. Research into how to promote and encourage moral repair remains ongoing, but some common recommendations include to accept reality of past moral wrongs and moral pain. It's important to forgive yourself and others, and participating in activities that help you confirm that their life and life in general has meaning. As I mentioned on previous slides, this can include rewarding activities, but it can also include meaningful connections with others. It's also important that you prioritize your own values as you determine and define them over the moral rules set for you by society. The values that you determine and define for yourself are easier to live up to than ones that come from an outside and much bigger moral order. It's important to practice self-compassion. This is critical. You need to be open to moral pain and associated judgments of yourself as just one aspect of being human. And you need to be aware of your sense of self, who you are, your identity or character, and how that is distinct from the moral pain you may be feeling. It's also important to identify the supportive people in your life. In order to create an atmosphere of acceptance, you need to build and rebuild strong social attachments. And when these options don't work, it's also important to consider professional support. Mental health professionals can help you talk about the process and talk to you about the process and make sure that you are resolving your reactions and feelings in a confidential and supportive environment. Each of the first two sets of treatments, one for PTSD and one for moral injury, have clinical trials in progress. These trials are being conducted with military members or veterans, and the results will provide insight into whether the treatments are effective in alleviating moral injury. The research is still in early stages. Although military and public safety personnel are distinct populations, some of the overlap in their work may mean that treatment options available to one would probably be effective for the other. And we also know that a lot of veterans change from one uniform to another. Thus, the findings from these clinical trials will be really telling in how we can treat individuals struggling with moral injury. So how do we respond to moral injury in public safety organizations? There's a few things that organizations can do. Number one is we have to look into what can public safety organizations do to prevent or respond to moral injury. The key component of this is creating a psychologically safe workplace. It's important to implement strong, empathetic leadership. It starts from the top. It's important to identify positive role models and mental health champions. Each organization has someone that can step up and has been stepping up, and we have to make sure that they have the platform to have their voices heard. It's important to encourage camaraderie and team building. In this sense, no one feels like they're on their own and that they have a team that they can rely on and fall back on. It's important to celebrate successes. In this day and age, now more than ever, it's important that we celebrate our successes. And even though they may be small, or however small they may be, we need to ensure that we are promoting and making sure people are feeling accomplished because of what they have done. It's important to allow for decompression time between exposures to stressors. Again, when you're exposed to potentially morally injurious events, you have to allow for that decompression time before you engage in conversation. It's important to monitor stress and enable flexible schedules where possible. I know this can be a little difficult during the virtual world, but it's important that we allow for folks to determine what their schedule may be, and if they have a significant or a tough day, that we allow for recovery time from that event. And it's important to provide support to families of frontline personnel where necessary. Organizations should also promote transparency and trust. So you need to engage in regular communications with personnel, and they need to be honest and timely crisis-focused communications. This has always been an important part of the job, but working in the current virtual world that we are in, communication is more critical now than it has ever been. You need to communicate organizational ethics and values and frameworks that drive decision-making. You need to engage in proactive collaboration, proactive collaborative planning and decision-making involving frontline and administrative personnel. It's important to be proactive instead of reactive. Engage frontline personnel from the beginning instead of being an afterthought. Organizations can also engage in moral resilience training. So you need to discuss moral and ethical challenges. You need to be able to discuss potentially morally injurious events and potential responses to exposures. You need to facilitate ethics scenario training to safely expose personnel to potentially morally injurious events and debrief them in a supportive manner. You need to partner less experienced personnel with experienced personnel. This is again a specific tenet of peer support, where those folks who have witnessed certain things are well equipped to be able to support those who have less experience or experiencing something for the first time. So it's important to have that balance and make sure that you're partnering less experienced personnel with more experienced personnel. So what can team leaders do? We know that team or unit leaders are also critical to preventing and responding moral injury, given the close working relationships that exist between them and their teams. We need to promote cohesive teams with high morale. We need to cultivate a culture of safety, non-judgment, and care. We need to discuss moral and ethical challenges. We need to discuss potentially morally injurious events and potential social, emotional, and behavioral responses to these exposures. We need to check in with personnel regularly. I know our calendars can fill up very quickly, but we have to make sure that we're putting time aside to check in with our team. It's important to create that space for discussion, that open, transparent, honest space. You need to encourage debriefing. And you need to encourage and acknowledge and affirm experiences shared with you. Try not to be dismissive of someone's feelings and experiences. It's important to validate what they've seen or been through. And as a team leader, you need to model positive coping skills and encourage self-care and help seeking. There are also some important steps that individuals can take to manage in the face of morally challenging or stressful events. They need to dedicate some time to learn more about moral stressors and moral injury. You need to take care of yourself by eating well, exercising, maintaining social connections, and resting. You need to engage in stress reduction activities like relaxation therapy, mindfulness, or meditation. You need to engage in self-reflection and expression activities. Connect with peers and support colleagues during shared experiences. And it's also to seek professional support if you are feeling distressed or troubled by your experiences. It's always important that if these emotions and feelings become too much, that you seek professional support, and that it's okay to seek that professional support. On a final note, we also cannot overlook the responsibility that needs to be shouldered across the community, media, and policymakers for how public safety personnel are viewed and the narratives that are created around the difficult choices they may have been forced to make. We hope that expressions of gratitude for the service and dedication of frontline public safety personnel will continue and will promote a sense of pride and the critical role that our PSP workers play in our communities. We know that they're stepping up on a daily basis. We have to ensure, as a result of the work and time and effort that they're putting into it, that we are supporting them the best way that we can. So community and government and policymakers have a significant role to play to ensure these right supports are put in place. I've heard from others that say that our system was broken before COVID. COVID is now just highlighting the cracks within the system. But how will we respond to a post-COVID world? How will we ensure that our frontline staff members are being supported and taken care of? And I know for us at the Center of Excellence on PTSD, we developed a moral injury guide that was specific to healthcare workers. You'll see that a lot of the recommendations and tips can be applied to the public safety population. And we're happy for anyone to visit our website at www.moralinjuryguide.ca, where you can access and download the full guide and other resources. And we'll continue to partner with CIPSRT to ensure that we are leveraging our resources collaboratively, so we're not reinventing the wheel or duplicating efforts, or providing the right supports to the population that we're trying to serve. Again, thank you for your time and attention, and I'm happy to take some questions now. And also, please feel free to follow up with me afterwards if you'd like to discuss anything specific.
Perfect. Well, thank you so much for that presentation, Fardus. We do have questions that have come in, so I will start with those, but please know that you are welcome to continue submitting questions, everyone. I do want to quickly just start with actually one comment that we received, and it was just based on the list that you included, and she indicated, her name is Tara, she indicated that she didn't see correction staff included, and that they too experience all that is mentioned, and she feels that they're often left out of the PSP definition, and that's frustrating. Just from a CIPSRT perspective, I want to just remind everyone that corrections is very much included in our definition of public safety personnel, and it's one of our missions to ensure that they're more widely known as being part of the public safety family. So that's just from our side. I think it's something that's definitely growing and changing, but I just wanted to address that comment first of all. Is there anything you wanted to say to that?
Absolutely, yeah. I think that wasn't an inclusive list, so I apologize for not including that term there. But yeah, you're absolutely right that they're a critical population and they are seen as public safety personnel. So just reiterating what you said, Emily, it just wasn't more of an inclusive list, so that's on ours.
Perfect. Okay. So first question up is, can you speak to how a PMIE might not just be what we did or what we were complicit in, but also what happens to us? It seems like your definition, it emphasized more the action of the person rather than the actions of others.
It's a great question, yeah. And it's not always about what you did or what you witnessed. It's also about what the government and what your organization has put you in. So that can also, but that sense of betrayal also comes from there as well. So it's not just the individual's own actions, it's also actions of others, so there's a sense of feeling betrayed. So potentially morally injurious events, and looking at Litz's definition, Dr. Brett Litz, it acknowledges the type of consequences that arise from witnessing betrayal by others. So it's not only yourself, when you take on an action that you feel like you've betrayed your own moral code, but also being around it as a result of that can lead to potentially morally injurious event and moral injury. So when you look at all the definitions and you combine them, as we're working towards a more inclusive definition, that is captured there. It's not just on the individual, it is also what the individual has been put through. So like in the healthcare community, we know that our frontline staff had issues with protective equipment, and as a result of not being able to go into work, or when they did go to work, they only had one set of glove or one set of masks, and they weren't able to change it. So this is not something that the individual did. This is what, unfortunately, public health had put them through, and that can also lead to a feeling of being betrayed by the system and by the group that you're trying to support. So it's a great point that you brought up, but it's not just your own actions, it's also witnessing what others have done.
I guess kind of a second question that also deals with this concept, but Anne is asking, I've also heard the concept of organizational betrayal. Can you compare moral injury to organizational betrayal?
Yeah, another great question. So, I think this is where we're talking about what organizations can do to make sure that you're being supported and not being put in a position to make these difficult decisions. So if you're continuously feeling that sense of organizational betrayal on a daily basis and it's sustained, that can lead to moral injury. Because, as I mentioned, that it's challenging your moral code and your moral ethics and your moral values, because your organization has put you in a position to make these decisions that you don't feel comfortable with, that you don't feel that you agree with. And if it's sustained over a long period of time, that can lead to moral injury. So that is definitely an important component of it. And that's why we recommend that organizations step up and ensure that they're supporting their staff to not be put in those kind of situations, to not be put in those positions to make those kind of decisions. If we can eliminate that and reduce the amount of times folks need to make those decisions, and we'll be supporting their well-being for sure.
Okay. So the next question, it's a bit of a clinical one, but I'll pass it your way anyway. Is the duration of impairment, is it the duration of impairment that differentiates moral injury from adjustment disorder?
It's a great question, but as a non-clinician, I'm not sure if I'm equipped to be able to respond to that, but I'm happy to take that offline and respond after the fact.
Sure. I will provide you with the questionnaires information. Next question was, when you were listing treatments, they noticed that you did not list EMDR or eye movement desensitization. Is that also an option?
Yeah, when our team tried to take a tackle of looking at what kind of treatment options are available, again, I mentioned that this is a still fairly new construct, and there's not that many clinical trials, which are quote unquote the gold standard for being able to say that this treatment option works. So yeah, the ones that have been listed there are currently what is in the literature, and I'm sure there's more emerging treatment options coming down, and in the next few months and years, there will be other options available as more and more folks focus their time on the research, focus their time on moral injury and look to treatment options. But the ones that were identified there is what's currently available in the literature. So EMDR I know works with Ptsd, but it's not something that has been seen in moral injury just yet.
So here's a question from Paul, and I think I'll take it if you don't mind, but it says, any particular reason why correctional officers are excluded from the list of public safety personnel? I think perhaps that goes back to an older idea where they often just listed the tri-services, police, EMS, and firefighters as being first responders. But I know when CIPCERT was established, we expanded the definition to be public safety personnel, and we automatically included correctional officers, border security, Indigenous emergency managers, 911 communicators in the definition of public safety personnel. I think it's something that has grown definitely in the time that CIPCERT existed. So correctional officers are definitely not excluded from the list of public safety personnel. I think they were just previously, it was often the tri-services that were listed first. So that's my answer for you on that, Paul. If you have other questions on that, though, please follow up with me. So Catherine says, thank you for your excellent presentation. Does the guide that you referenced include intervention ideas for clinicians?
Sorry, I didn't get that question.
Sorry, I'll try again. So does the guide that you referenced include intervention ideas for clinicians?
It's a great question, yeah. So it's not specific to clinicians, but it is, we've made recommendations for what team leaders can do. So not only what organizations can do, what team leaders can do, and what individuals can do. So as a clinician, you're seen as a team leader, you might have folks that are reporting directly to you or that you're supporting staff. So there are things, as I mentioned in the presentation, that team leaders can do. And, it's also the same for clinicians and healthcare communities. So, you have to ensure that you're providing cohesive teams with high morale, cultivating a culture of safety, non-judgment, and care. Being able to discuss these moral and ethical challenges, making sure that you're checking in with personnel regularly. So this is specific to how you're supporting your team and not an individual that might be coming in through your clinic or your hospital trying to look for support. But as a team leader, of course, you need your own supports, and that's where the organization needs to step up. But if you have folks that are working directly for you, there are some specific tips that we would recommend that we would be hopeful that you can take on, and as a result, make sure that your staff are feeling supported and taken care of. So there are some tangible pieces there, and we're also working on a toolkit for leaders. So we know role that leaders play in an organization, and making sure, if they hear it from a leader, there has some impact in the domino effect and the rollout of certain things. So at the center, we're working with hospitals right now to make sure that leaders are equipped with, infographics, toolkits to be able to respond to these events, but not specific to how a clinician can engage. That's not what's in the guide right now.
So are you working with the Canadian National Standard Psychological Health and Safety in the Workplace? And what are your thoughts about that standard?
Yeah, we're not working with them directly, but of course, they, for looking at a psychologically safe workplace, they've identified some key factors, and you'll see the guide has some overlap in there. It is one tool in the toolbox of certain things that we can do to ensure, work environments are safe and protective. But I think they have identified some key critical elements, and a lot of mental health organizations have provided their insight and input into the development of that. So I would say it is definitely an important component. But we're also seeing that, this post-COVID, or during this COVID world, has really amplified and shown us that we have to do a lot more. So this is where, the concept of moral injury, as I mentioned, is something that started in the military and veteran populations, but now we're seeing it across the board with so many different populations, and we're seeing it, as I mentioned, in healthcare communities, in the public safety domain, but also with judges and jury members and folks that are sitting on boards, even that have to make these tough decisions. So I think that there's a lot of work in front of us that we need to do, and I think we have to leverage all the tools in that. Looking at the standard being one of them in the toolbox.
So the next question is, I have a client, an analyst with the police department. She's on medical leave now. She's ashamed of working for the police and hates herself for it, and doesn't disclose this to others. Her values don't line up with her workplace. Am I correct in thinking that this fits with moral injuries?
It sounds like she is expressing some symptoms where, her daily life of working has been challenged, where her moral values, as you mentioned, her codes aren't aligning with what the organization might be promoting. So it's hard to just basing it off the current comment to make that kind of diagnosis, but it's one of those things where those are the early signs. We don't want to pathologize it, but I think we have to allow for a safe space to have that conversation. And if she's not willing to open up about it with someone specifically on the team, I think we need to make sure that we're providing access to a mental health professional who can have that conversation with this individual. But it seems like, when your moral compass, your moral values are being challenged on a daily basis and is being sustained, then we can say that could lead to moral injury. But it's hard to definitively say that. It just seems like there are some early symptoms that should be cognizant and aware of. If you can put in place some of those items and tasks that I mentioned earlier, I think it could help facilitate the conversation. And if not, then it's important to just offer them that opportunity to speak to a professional.
For sure. Do you think, considering the recent changes with the Black Lives Matters movement with police, that that's something that there may be moral injury might be something that's more commonly experienced now?
Yeah, it's another excellent question. I know we've heard anecdotally, a lot of police members, have felt that they've been kind of put into the same category by everyone as a result of some of the situations that have come up as a result of the recent systemic racism out there, and that could lead to folks leaving a vocation that they're really proud of and that they really care about. So we have to make sure that we're not grouping everyone into these buckets. And again, we have to allow for our police force members to have that conversation, to be able to have that dialogue with their team members and to express those feelings that they're feeling right now. They're at times definitely putting themselves at risk, in high risk situations, and to see some of the commentary out there is difficult. And on the flip side, there are police members who are people of color. As a result, they're also feeling additional challenges because they kind of see themselves in the population that is being affected currently. So there's that added layer of being potentially a person of color and then seeing, what's happening to your community, and you might not be able to intervene, you may want to intervene, and that also weighs heavy on your moral compass.
So next question is, I'm wondering how the relationship between complex trauma and moral injury is. How do they interact, and how do we disentangle these with clients?
It's an excellent question. So I think, yeah, this was building off of what was mentioned earlier around, we're still learning the difference between what PTSD is, what moral injury is, how does it differentiate from depression, from complex PTSD, from complicated grief. And there's a lot of overlap currently. And as part of our work at the center, we're working on the development of a moral injury outcome scale. So working with Dr. Brett Litz and an international consortium to develop a gold standard way of measuring moral injury. And currently there are some scales out there, and they have their merits, of course, but they also have some problems with them. So we're hoping, as part of this international consortium, to develop a moral injury outcome scale so we can definitively say that someone who ranks high on these items has a moral injury. And currently we don't have something like that. Anecdotally, we know for sure in conversation with veterans or anyone in the public safety domain that they'll tell you that they're not struggling with PTSD or it's not complex trauma, that it's moral injury, that they're feeling that sense of guilt and shame and betrayal, which are, as I mentioned, core features of moral injury and not so much of PTSD or complex trauma. But there's still significant overlap between these elements, and until we continue doing the important research in this space, we won't be able to definitively say what are those differences.
The next is just a comment. I think it's a comment when you're talking about organizational betrayal. And it just said, this is so bang on. As someone who works for the RCMP support for our operational stress program, I see this type of injury all the time and have experienced it myself. We included this organizational stress, which is not clearly defined, but seems to include everything that's not a result of a traumatic frontline activities. And we're told to discourage bashing the organization. This means not listening to those feelings of betrayal and unfair decisions.
It's unfortunate, I think, as I mentioned, that we put certain, public safety personnel in the positions to make these unfortunate decisions, and then we can eliminate them and we can avoid them. And if we can't, I think making sure that we have those right supports around them so they can have that open dialogue and not feel like they're being thrown to the side. So I think, having the discussion, the conversation is a great start. But as I mentioned in my final point was we can't overlook the role of community and policymakers in making sure that we're setting up our system to not ever put anyone in those kind of situations, or at least try to eliminate or reduce them as much as possible. Because we know it's a very difficult job. We know it's a high risk, high stake job, but if we can do our part, and I mean the collective we, in supporting our staff, then we'll be reducing the amount of folks showing up with symptoms and diagnosis of any mental illnesses.
Next question is, what would you say to an administrator who says, if you can't stand the heat, get out of the kitchen?
See, that's a helpful dialogue. I think, we don't want to have that kind of discourse or that discussion. It's just it's unfortunate that there are those kind of situations, and that there are certain members on the team and organization that will make comments like that. But that's what leads to the stigma. That's what leads to folks being more isolated and feeling withdrawn, because they can't express their feelings. They can't express, what they're going through, and it is our part, as we can't have that kind of environment. We can't have that kind of discourse. And we've seen it in mental illness for many, many years. We've done a great job of chipping away at the stigma, but there is still quite a significant amount of stigmatizing language out there. And as a result, people aren't going to ask for help or come out and say that they're struggling. And what are we doing then? We're hurting more folks. So I would say, that it's important that you share resources with them. You share, infographics and tools that kind of break it down, and it makes it clear to them that they can't have that kind of, they can't make that kind of comment, that they can't have that kind of the discussion. we always speak to the importance of compassion and care, and empathy. And we know all of these help in moral resilience and build resiliency. So if we know that, why are we actually making those kind of comments? I apologize that you had to feel that, but I think it's important that we continue to highlight and spotlight the fact that it's not helpful and it's actually detrimental and hurtful to make those kind of comments.
Okay, so next question is, does Veteran Affairs recognize moral injury?
It's another great question. So yeah, it's not a diagnosis currently in the DSM. So moral injury, as I mentioned, it's been studied in the military veteran population since when Shea first coined it in 1984. So it's something that I'm sure they're working on, but it's currently not a diagnosis in the DSM. So that's where our hope. I know when we developed the COE in the early days, we had conversations with veterans and their families. Moral injury continuously came up in our discussion. So we put our stake in the ground and said, this is an area that we're going to tackle. And by that, I mean, we're going to research it. We're going to make sure that we're developing resources and tools, and hopefully at the end of the day, be supporting VAC to make their decisions to importantly identify and include as part of their treatment review.
Okay, so this is just another comment. As a clinician, the Moral Injury Workbook by Evans, Walser, Drescher, and Farnsworth has been helpful for working through moral injury with some of my clients, in case this is helpful for others on the call. Just wanted to share that with everybody. So we're just going to do a couple more questions as we're getting close to the end of our time here. The next question is, if moral injury has been untreated, unrecognized, undiagnosed, and I have left the job because of it, is it possible that I'll be more sensitive to this in another job? I suddenly seem to be uber sensitive to things that don't jive with my moral compass where I didn't before.
It's possible, given there's that unresolved trauma that you felt as of being on the job on a daily basis. So if you have to sustain those kind of injuries on a daily basis, you have that unresolved trauma that needs to be first taken care of. But we know that having going to another job or another place that has that more cohesive, high morale, high functioning, a team supporting one another, that can lead to recovery and that can promote moral resilience and moral growth. So I would say yes, there's a possibility of that growth, because you've changed your job and you're not being now challenged. Your moral code is not being challenged on a daily basis. Then there is a good possibility of you getting better, but you still have to look into that unresolved trauma, depending on how long you put up with it as well. If it was for months and years, then I would recommend speaking to a professional to tackle that on. But you'll see that the change in environment and the change in scenery and the fact that you now have an organization and a team that is behind you, that's going to have huge positive implications for your health.
Okay. All right, so last question for you is, does the Center of Excellence offer training to police leaders, chiefs, and boards?
Currently, we don't offer that. I think that's where we're hopefully maybe we can work with our colleagues at CIPSRT, to develop a training or a module. And we are looking to maybe develop something for veteran clinicians that work with veterans and their family members. And as I mentioned, we can leverage existing tools and resources. And even earlier, there was a mention of a workbook. There are stuff out there, but I think there's more we can do, and we want to do that in partnership with CIPSRT and the team there. Really collaborative already. So as we develop things and as they develop things, I think we need to stay connected, because our populations, as I mentioned, people change from one uniform to another uniform, and there's a lot of overlap. So we currently don't have a workshop right now, but it is something that we're hoping to have in the works down the road.
Okay, perfect. All right. Well, Ethana, thank you so much for joining us today and for our audience for this great session. There'll be a quick survey at the end of the webinar. We hope you'll take a moment to complete it. We also hope you'll consider joining us for our next town hall on June 24th. The title is PTSD Crash Course. It will be led by Dr. Megan McElran, and this This session is designed to answer all your questions about PTSD, symptoms, treatments, and the myths. The link for this event will be included in your video follow-up email. This town hall on the 24th is also the final event in our PTSD Awareness Month activities before the June 27th PTSD Awareness Day. We hope that you will all join CIPSRT in wearing teal to support PTSD awareness and get stigma out and understanding in. Once again, thank you all for being here. I want to encourage you all to take care and stay safe. Thank you again.